Hello, social workers, mental health professionals, and change agents. Welcome to another episode of the Social Work Rants podcast. I'm your host, Bass Marino. Saludos a todos. Greetings, everybody. Thank you for tuning in, tapping in wherever you are watching or listening to this podcast. Gracias a todos por su apoyo. Thanks for everybody for love support. Rocking with the podcast like you guys been doing. Uh, Continue to follow the podcast on all social media outlets at Instagram at the Social Work Rants Podcast. That is all one word. Follow the podcast on Twitter at Social Work Rants, Facebook, aka Meta. Type in the Social Work Rants Podcast. Hit that like button, and of course the YouTube. Uh, Subscribe to the YouTube channel. However you listen to podcasts, rate the podcast, leave comments, reviews, and all that good stuff. I had the great pleasure of meeting this talented social worker at the national conference on social work and HIV/AIDS in Washington D.C. recently. Mr. Corey Ingram, how you doing, sir?
I'm good. I'm good. I'm good. How are you doing? And I
I'm doing
appreciate
great.
that intro. Yeah.
No, of course. Uh, let's get into it. How are things going since we met at the conference?
Oh, hey, things are going great. Things are going great. I actually have had a couple of connections with some other entities, um, and actually with some individuals who are working with Gilead as well,
Okay.
about possibly doing some capacity building, some organizational trainings, some different things like that. So actually, DC was actually great for me. So I have no complaints, no complaints about DC. So yeah, very much so was a good time. Yeah.
That's that's what's up. Before I go any further, I always forget to do this disclaimer on the video side. This episode is not a substitute, or this podcast is not a substitute for mental health therapy. If you need any sort of assistance or anything, call 911 or if you have a therapist, or just go to the ER for or call 988 and seek help. It's okay to be okay. For those out the country, whatever your emergency services are, reach out to them. So now I got that out the way.
Yes,
uh,
sir. Yes, sir.
um, yeah. So for those who don't know who you are, let people know who you are, what you do in this crazy space of social work.
Okay, so my name is Corey Ingram. I'm a licensed social worker, LMSW. I'm licensed in the state of South Carolina, although I work in three in three states. So I work in Alabama, work in Georgia, and I work in South Carolina. So I do mental health therapy um, at two boys group homes. Um, I also am a PhD student in the School of Public Health and health behavior health promotions and behavior. Get my PhD in healthy Black masculinity. That's my area of concentration um, within the School of Public Health. And so I
Which school is
actually have,
Georgia?
yeah, University of Georgia. So down in Athens, Bulldogs. So right now they trying to defend the national championship. So we'll see how that goes. Um, and I do some focus group evaluations, qualitative data analysis and research for what's called DHEC, so Department of Health and Environmental Control here in South Carolina. So we just gotta, trying to do what we can, and I also do trainings and presentations around basically anything related to interpersonal violence, healthy Black masculinity, consent. Also, different things around HIV and Black mental health. Um, so a variety of different topics. So I've been working. I've been a social worker now, what, 18 years. Um, so yeah, so that's kind of, I guess, the gist. So
Cool. What what are you seeing in terms of down south? Though no, I'm up north. There's always this well, news play a big part of it, and some political figures down south don't make it any better.
Hmm.
But it's always this bias of the South be acting a fool. They on another level.
Oh yeah.
What do you see in like the space like relates to social work and what people are going through right now? In this space.
Um, I think what a lot of people are experiencing is the conservatism of uh, thought processes and beliefs. So we have a lot of conservative policies here, whether it's healthcare, so different things around abortion,
Mm-hmm.
women's rights, all that, those different things as it relates to healthcare, or if you want to even get into gun control.
Mm-hmm.
So we do have a lot of conservative values here, and of course that rolls over into social work, especially when you get to talking about different things that go on with children, especially children who experience some form of trauma, especially at an early age.
Right.
And so that conservative mindset, sometimes restricts them from receiving the appropriate services needed for them to be successful. And so that's sometimes we run into those barriers just because of the policies and different things that we have here. Even with the Affordable Care Act or
Mm-hmm.
Obamacare, whatever people
Yeah.
like to call it. Um, there are certain states, Georgia is one, that have put roadblocks and barriers in the way of the Affordable Care Act. And there are certain aspects of the Affordable Care Act that would benefit, and and which is interesting to me because a lot of people feel like the Affordable Care Act is structured to provide health care for minorities, more, particularly black minorities,
Right.
not understanding that the Affordable Care Act is for everybody.
Yes.
I mean, I understand people called it Obamacare, but it's actually the Affordable Care Act for a reason. And so a lot of people get caught up in those names
Mm,
and not understanding, what the true ideology behind the actual, around healthcare. And so then, like I said, you have situations where you run into situations where individuals need it, and unfortunately, it's not there for them. So.
right. And part a lot of that has to do with the lack of Medicaid expansion and you
Mm-hmm.
know and all that interplay and quite frankly, there's more poor white folks than anything else, but people don't want to talk about that.
Right, right, right. And because of certain rhetoric around the Affordable Care Act, people don't even know because it is funny. Literally, we had a town hall meeting where people were talking about Obamacare, and people were saying how they didn't want Obamacare, and then literally in the same town hall they started talking about the Affordable Care Act, and people started asking about, well, how do we access the Affordable Care Act? Not understanding that they was one and the same. And I was just like, see, this is the problem. This is the issue that we're having because, like I said, people listen to the rhetoric on the news or whatever,
Mm,
wherever they're getting their information from, and not
right.
really understanding the policy itself. So,
Yeah,
yeah.
which is why my work during working with clients with HIV, and I use Affordable Care Act and Obamacare interchangeably. Let them know it's the same
The
thing.
same thing. There you go.
Is you just getting insurance, and for a lot of people, it's going to be the main stopgap for insurance now that Biden signed off on the COVID emergency is now over, so people are going to be
Mm-hmm.
losing their Medicaid, and so
Mm-hmm.
their next
Mm-hmm.
step is going to be ACA, Obamacare.
Mm-hmm. Mm-hmm. And hopefully, it's going to be interesting to see who the next president is going to be. But hopefully, they will figure out that expansion of the Affordable Care Act is really needed, especially given all the uncertainty we have with just with the country and what we're doing as it relates to, the dollar and, you know, jobs with AI and all this other kind of stuff. The other thing we need to have is insurance, health insurance. So,
Yes.
yeah. So I'm hoping that whoever comes in are going to be sensitive to those needs and sensitive to that idea, and so we'll be able to keep that idea and concept of the Affordable Care Act going. But
Uh,
we'll see.
and it also goes into who you vote for Senate and for and state government too. So it's like the president could be like, I want to do this, and then they get shut down.
Shut down. Yes, and that
That's
happens all the time, as we
yes,
see.
yes. So especially Obama's second term.
Oh yeah, yes, yeah. They weren't trying to hear. They weren't trying to hear nothing he was saying.
So yeah, it don't matter who is president. It's just unless is a Republican and they got Republican Senate and House, then starts happening, but not in a good way.
Yes, yes, and that's what I'm not even gonna get on the political bandwagon. I'm just gonna let that go right there. But yeah, we'll see what happens in 2024. We'll see what happens in 2024.
For real. Now, why us study uh black masculinity, black masculinity in for your doctorate?
Um, so it is, I guess, an interesting way I came about it. So, I actually used to work at the University of South Carolina. So I built their first male program, which is called True Strength. And from my understanding, the program is still going on there. And in the process of building that program, I actually went to South Carolina State to do a training for the Healthy Masculinity program. And while I was doing that training, South Carolina State has a organization, the 100 Black Men organization,
Mm.
on campus. And so, but it's all college students. And I had a couple of young men. One was a senior, a graduating senior, and then two other were juniors. And after I did the program and the training, we had a very good conversation, and where they was telling me that, yeah, the training was good and they understood some of the information, um, that I was detailing in the training, but they didn't feel as though the training completely applied to them. There were aspects of the training that they felt as though um, they really couldn't understand and really didn't apply because they didn't have those experiences as Black men. And
Mm-hmm.
it got me to thinking. I'm like, I understand where you're coming from, because there are a lot of things about masculinity that we talk about, that are social norms when we get into protecting and providing, and those different things. Having the privilege to be able to move about and protect and provide at will is something that people of color, understandably, don't necessarily have that privilege.
Mm-hmm.
And so, just as we begin to talk, I began to understand that there are some things conceptually that we need to actually talk about as it relates to people of color, as it relates to masculinity. So that led me to create Grit, Gentlemen Respecting, Interacting, and Truth. So I created that, like I said, while I was still at USC. And then when I left USC, I began to expand that thought process.
Mm-hmm.
And so once I started, uh, you know, because Grit actually started as just me as a Black male giving my perspective on Black masculinity. And now, of course, it has grown just with all of the education and different things that I've been doing, with the idea of understanding and knowing that, that we all, no matter how we identify, we all have masculine genes and feminine genes. And what does that expression look like? And so, it is amazing how things grow, with information and knowledge. And experiences. And so I'm just expecting this to grow even more. But the young men at South Carolina State sparked my interest in the thought process of being able to identify masculinity um, for yourself or ourselves, however you would like to say that. And it just kind of, led me down the path that I've just continued on.
I like that. That's very fascinating and interesting. And I know there's a lot of topic, about that. What does Black masculinity look like? How's evolving? Or, uh, we got a lot of celebrities, kind of a lot of individualism going on, and it's like, and then they get labeled one way or another, and it's just a lot of, some
Mm-hmm.
of it's a lot of nonsense. It's like, just do you, whatever. But it's like, what is that? You see that in some of the research, or uh, what you are studying now, or just
Um,
from a personal experience?
well, yes, yes, and no.
Okay.
And I will kind of elaborate on that because interesting enough, um, when you get down to it and get into the weeds of whether it be healthy Black masculinity or healthy masculinity in general, but especially healthy Black masculinity, it's very interesting that you'll find that there are a lot of white men and Black women who are prominent, I would say, in the field as it relates to healthy Black masculinity, or people who have published. How about that? I'll say that because
Hmm.
I guess prominency is a matter of opinion. But people who have published, you will find that there are, which is, like I say, interesting, which is an interesting concept. Just given that um, what the subject matter is, and so I think um, for a lot of people now, because of where we are as a society, I think a lot of people are realizing that, oh, okay, we may need to come up with these definitions for ourselves. And so you have, because of, and also too, I think because of the times and everybody and all the conversation around toxic masculinity. So when people are exhibiting some form of masculinity, especially in the movies, in the Creed movie, that was a big thing. With Michael B. Jordan and Jonathan Majors, you know, every seemingly like every interview they had, somebody was talking to them about what is Black masculinity, what does it look like, what is their definition, all that kind of stuff. And so it's kind of been pushed to the forefront. But
Hmm.
that's also the thing is I don't think we have ideas and concept as a group about what is Black masculinity. And so now you have individuals who are making those individual uh, definitions for themselves. And so I am hoping that we will have a collective baseline, you know, and whatever that baseline is, and then once we have that collective baseline, then people will venture off into their individual ideas and theories about what Black masculinity means to them as an individual.
But should there be more actually Black men, or those who identify as Black men actually doing the research in order to come up with a baseline?
Um, that's probably a trick question right there. But I would say definitely more Black men involved with the idea of creating that baseline. You know what I'm saying? Whether it be, as active participants in the research, or, actually doing the research themselves. Like I said, I do find it interesting, especially on the qualitative, the quantitative side of research. I get it because people can make the argument that numbers are numbers. Numbers are not going to change. It don't matter who's
Mhm.
doing the research. Doesn't matter that thought process. The numbers are the numbers.
Mhm.
So I can get that. But on the quantitative side, I mean the qualitative side. On the qualitative side, coding and all those different things, the data analysis that you use on the qualitative side is about your experience and your perspective. And
Mm,
even though there is, even with the coding, there is a baseline you have to use, it's still left up to your interpretation. And so when that's not your experience, I think you can have an altered interpretation of certain things. And so that's where it comes in line that it may be good to have, if not, you know, like the principal investigator, PI, whatever, having Black men actively involved with that research and with that information, because they're going to have a little bit of insight that other groups, other individuals, other people who that's not their life experience, that they're not going to have. And so,
mm.
yeah, I would say having them involved, because like I say, I know we're in a space and a time that you know uh, limiting anybody from doing anything is not appropriate. I'll just say
Yes,
that.
yes, that's true. Let's keep keep it right there. Let's go with something
Yes.
else.
Yes. So but I'm hoping we'll that as we move forward and as we begin to have the discussion more, because just different things that are going on, you're seeing situations in California, Chicago, Detroit, like all these different situations with a lot of youth violence and stuff. And so
Mm,
now you're actually seeing a lot of people talking about Black masculinity. What does that look like? How do we show up? Like all these different conversations are coming up, and so I'm hoping as these conversations continue to happen, that more people will get involved and share their voice, and there will be a collective, like I said, just a collective baseline, and we can kind of have an agreed upon baseline thought process, and then we can move forward from there.
well, also, now switching gears, you mentioned you've been doing some presentations and like um I've gotten into doing presentations a little bit within like the last year. How how
Mm-hmm.
how can like so if somebody want to like do a talk or like want to present like the conference that you just did, or there's always an NESW conference somewhere in the country, or other people doing their own thing, festivals or summits and stuff. How like like describe like your like process, or like you want to like participate in the conference. What does that look like for you?
For me, I'm not going to say that everybody should go the route that I went or that happened for me. Um, because I really looked into uh being able to do presentations and trainings. So my supervisor, when I was working at USC, my supervisor, I hope she don't mind me using her name, but Stephanie Hinton, who's a Black woman, was my supervisor, and which is great. It was amazing because when I started at USC and people started asking me to come out and do trainings, she probably gave me the best advice ever that I ever had, that kind of kept me grounded, that kept me kind of working towards improving and keep moving. Because when I first started, she brought me in her office and she was like, these trainings are a novel idea, because at that time, dude, we were talking about 2013.
Mm,
So we really wasn't talking about healthy masculinity, and definitely wasn't talking about healthy Black masculinity at that period of time. And so she was like, I want you to understand, when you start getting these invites to come and do trainings and presentations, keep in mind it's not you, it's the program. And she
mm,
kept drilling that in my head. And so um I started submitting conference abstracts, and so that's how I got my start. But she was okay with me going. So I mean, I would use, basically I didn't have to take any time off work. I was
mm,
because I was representing the university, it was still considered work time. So
Mm.
I was going and presenting and still getting paid for my regular job.
Right.
So that's why I say, I don't want to I don't want to be the barometer, but because I kind of looked into it. But once I started presenting at conferences, you know, similar to how we met,
Mm.
people, would come into a presentation. Some people like. I mean, I've gotten opportunities because people didn't like my presentation, which that was interesting as well. And I've gotten opportunities because people wanted to have me to come into a space that they want to debate what I was saying.
Mm.
And I was open to that too, because I mean, I don't feel like I know it all, or that I'm saying I have I'm saying a lock on a certain area as it relates to any topic that I talk about. So I would say definitely you do want to submit abstracts to different conferences. Um, I would say like I said, the advantage I had was working at a university. I was able to go and do, you know, big conferences, national and international conferences, pretty early. But
Mm.
I would say start off locally, because the best thing you can have is a support system. So I would say, start off locally, doing some local conferences, and then just grow yourself that way. Local, do something within the community, do something within your state, do something within your region, district area, then national, and then possibly international. Especially when you're talking about like different things as it relates to NASW or even NSAC, so National Sexual Assault Conference. So
Mm.
both of those organizations at times have international conferences here in the states. So
Mm.
it's still a way that you can get that experience, because also too was a great thing, which is why also what I love about the conference in DC is because a lot of times a lot of people go to trainings just to present, and they don't actually attend the conference itself.
Mm.
And I think you're doing yourself a disservice,
No,
because
I agree.
yeah, because when you go to a conference, you need it's always going to be something there that you probably don't know something about or can learn more about.
Mm.
Also, I love going to see other people present, because I can pick up on, I pick up on little tad bits. I take little bits of pieces from everybody.
Mm.
So, where somebody says a word, or maybe their opening, or a story that they give, anything. And so I think as well as when you go to a conference to present, you need to attend other trainings and just soak in whatever you can from other presenters. I think that's probably the biggest thing, because you're always going to be in a state of learning, because information and things change. And
Yeah,
so
absolutely.
you want to, if you're in this, you want to be able to change and keep up with way
Yes.
things are going.
No, absolutely. There was a bunch of words that I never heard of before, and one word that thanks to you, have embedded in my head that to do my very best not to ever use the word.
Yes, 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 yes. Well, yeah, understanding the background of different words is important, and that's interesting enough, because even for me, like with the words you're talking about in particularly, it wasn't until I came to the University of South Carolina that I even knew anything about that. You know what I'm saying?
Mm.
South Carolina, especially Charleston area, had a lot of breeding houses. You know what I'm saying, during slavery, and so it was just researching and getting some of that information, finding out about that kind of stuff, and was like, wow, this is information that, people, especially here, what I'm saying, I'm in South Carolina now, but especially in South Carolina, I wondered, do they know? And once I started presenting on it, I found out people really didn't understand and know. I
Mm.
was like, yeah, especially people from here, you should know, you know, this type of information. And so,
Yeah.
and then once, that kind of grew, once we started getting out nationally, I was like, oh, I realized that a lot of people didn't know.
Mm.
And so, yeah, so and I think that's also too part of a training is you want to give people something that they may not know. You want people to feel like they are learning something from you that they can take with them. So yeah,
Yeah.
so I appreciate that you saying that because that is a goal and objective.
Yeah, yeah. No, no. I had a great time in DC and meeting so many people, and I did a brief recap about my experience at the conference, and it seems like people had like the same themes. Doesn't matter what state in terms of housing and transportation issues.
Yes, yes. Well, that's going to always be a thing. A lot of states are, and a lot of cities. I mean, not just the state. A lot of cities are cutting back as it relates to public transportation, and so downsizing as it relates to public transportation, and it's a housing shortage even with people who are financially
Mm,
who are in a financially good situation. It's still a housing shortage. So if you got the money to buy a house and you can't find one, you can only imagine people who are looking or trying to subsidize
yeah,
what the market is going to be for them. So yeah, though. And unfortunately, I think housing is going to continue to be an issue. Transportation, we'll see. I'm interested to see what's going to happen with transportation once we start really getting into AI. Once we start getting into this quote unquote automated system of transportation, I'm just
right.
wondering what really is that going to look like. And so, we'll I don't know. I mean, people are saying it's going to be better because now they're not going to have to pay. You're not going to be paying bus drivers and all that kind of stuff. So supposedly the maintenance and all that going to be down, and they're going to be able to run more routes and do. But it's one thing to say that. It's another thing
Exactly.
for that to actually happen. So I'm going to be
Yes.
interested to see if that truly happens. So yeah.
And and some states are more equipped to do that type of work than others than in other
Yes.
states. So it's
Yes. 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 Yes.
uh, no
So yeah. So it
where
may
I'm at
it
it
may it
where
may
I'm
ramp up in some states and then fall off in others.
yeah
Mm-hmm.
in my state of Delaware, like we up north, but that's not happening. No way,
I guess.
unless they use some of this marijuana money that's coming in 2024 and put that in in place, but
Man.
they need to give some a nonprofit some housing money and help people with HIV and mental health through a supported housing program or something, because that's other states have it and they still have issues with placing people in housing, and we ain't got nothing like that here, and it's like they're struggling. He's right, it's only going to get worse because people is going to be like losing their homes because they can't afford to pay rent or mortgage, and
Mm-hmm.
so that that's
Mm-hmm.
that's coming, and nobody's talking about that. So
No, 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 no. And I do like and appreciate that the awareness and the thought process as it relates to the idea of people waking up um to understanding that we all need some form of mental health.
mm,
And I am hoping that as we move forward as a society, that especially within the HIV space, that there are going to be opportunities to openly have the conversation about mental health being a resource for any and everyone. Um, you know, uh, we kind of, I know I didn't get too in depth with it with my HIV and Black mental health training. There is a longer version of that training where we get into kind of sort of the idea of the stigma and the different things that are associated that we kind of gloss over when it comes to mental health,
mm,
especially in the HIV realm. And so a lot of times we don't, or I feel as though the mental health piece is not appropriately addressed. And a lot of times people don't receive the appropriate services that they really need as it relates to mental health. And so, you have people who receive, like I say, they can receive housing, receive, food vouchers and different things like that. But that goes back to the whole equity, equality, and justice conversation.
Mm-hmm.
If you give everybody $1,000, some people are going to be broke tomorrow. Some
Exactly.
people are going to have that, you know what I'm saying? Some people are going to build on that $1,000. Other people are going to use it for, you know, maybe illegal situations because
Mm-hmm.
you didn't give them any education behind the money. You just gave them the money.
Right.
And so I think that happens a lot of times. We provide people with resources, but we don't get to the root of the issue that brought them in for the resources. And I think mental health is a part of that.
No, absolutely. Especially when we're having at least in Delaware, seeing early 20s, newly diagnosed, and then we're seeing a lot of Latino Latinx who are coming into the country, and then they either coming into the country not knowing their status for whatever reason, then they come here with better healthcare, and then they find out they're newly diagnosed. So dealing with that, plus you're newly migrating into the country with like since
Mm-hmm.
just like COVID, so just the aftermath of that, plus all that trauma is coming into the country to the pandemic, which I can't even imagine. And now you're
Mm-hmm.
newly diagnosed with HIV, so it's like, and then like how could it be? And then so it automatically
Mm-hmm.
starts that anxiety, the depression, and not fully understanding the HIV diagnosis,
Mm-hmm.
how just the whole basic education. How do you contract HIV to like now you understand? Hey, by the way, like Biktarvy is a game changer, and like you'll
Mm-hmm.
be as long as you take it every day, within the next couple months, you'll be all right. You just gotta get through this little bit, and it's kind of it'll be hard because somewhere I ain't, you think it's the end of the world, and then another spectrum is like, okay, the newly diagnosed, and then like just aloofness. So like, all right, okay, I just take medicine. It was like, and that throws me off more than like I rather deal with the anxiety of be like, okay, like it's gonna be okay. We're gonna get you on medicine, get you on the regimen, compared to somebody that's like, all right, so I got HIV. Okay, like just give me the meds. So it's like that's you don't feel any type of way. Like it's like
Right, right.
so that's fascinating from what I've seen so far.
Because you wonder if they're hiding their feelings and emotions, and so
Mm,
and that could be triggering because you never know what may, something may happen to trigger those emotions, and then you don't want that to be a negative impact, and so yeah, so I definitely can understand, when you have people who are aloof, and you definitely want to check and make sure that they are able to comprehend. Okay, yes, I do have HIV, and this is going to be a process. Like, this is not something that I can, that, like you say, you can just take meds, and you still have to eat and take care of your body and
mm,
go to the doctor and visit and all that kind of thing. Hold on one second, Nick.
yeah. So while I'm on hold, I want to let people know that on June the 30th, I'll be hosting a financial education class. Just gives up my backstory as to how I got into it. You know my story, but first time homeowner, like the last 30 years, and learning some financial education so that I can help better myself and my family. So definitely tune in. Web, bassmarino.com for the presentation. So hope to see you there.
Oh yeah, I'm going to tune in because I'm trying to get more financially literate myself. So yes, I'm glad you said that. I'm gonna tune in myself. Yeah, go ahead and mark that on in my calendar.
Awesome. I usually ask people this, especially I call this time the post COVID era that we live in, and I don't know if you saw the email. Somebody tested positive at the conference. So I was like, running home to take the at home tests, and especially I was having like some cough symptoms, and my throat was like a little scratchy for a couple of days. I was like, oh shit, let me go get tested. But
Yeah, yeah.
but
I
how?
saw the email, but I felt kind of good. But I was mad. I was made up throughout the whole conference. I'm taking the cold ease. I'm all of that.
but how was like no pandemic no for you then, not only just COVID but also everything uh that transpired, you being a social worker but just being your person first. So how was COVID for you, then everything that obviously that happened with George Floyd, Breonna Taylor, and the countless others that's still happening, presently, and before they passed away. Like how was all that been for you?
Whew. So COVID. I the first year of COVID. So when COVID hit, and at first in 2020. So I thought I was doing good, and trying to keep my distance, wear my mask, doing all the things that I thought we supposed to be doing. And so literally February of 2021, I caught COVID.
Mm,
So I was like, man, I made it all this time and now I catch COVID. Uh that was interesting because I was just I I didn't understand it. And but what COVID did, and of course, once again, hindsight is always 2020.
mm,
Had I known we was going to be locked down for 2 years, I probably would have created a different regimen of things to do. But one thing though that I appreciated or I took out of COVID is without COVID, I don't think I would be getting my PhD. So due
mm,
to COVID, led me to getting my PhD or going to school, applying for a program and going to school to get my PhD. So COVID presented that opportunity. Um, as far as like nationally with everything that was going on, I think also COVID made a lot of people who were not aware of some of the struggles within the minority community. They made them because everybody was sitting around
mm,
on social media or in
yes.
front of their TV and different things like that. So you was able to really see just some of the inequities as it relates to criminal justice system, healthcare, police reform, just a myriad of different things.
Mm,
Job opportunities, housing. Like you were able to like really they were put in your face, so you
mm,
really couldn't deny
right.
some of the inequities. And so I think the things with Breonna Taylor, George Floyd, um, Arbery, like
Mm,
all of those different things. I think you know it brought some things to the light. Um, the disappointing part of that, though, especially from a social work perspective, is we really still haven't seen any change.
mm,
A lot of people marched, a lot of people petitioned, a lot of people, posted, memes and different things, but no real laws or policies were passed.
mm,
Um, and so those type of things, unfortunately, I'm kind of disappointed in, um, because giving the swell of support for those incidents, you would have thought that by now, like the George Floyd Policing Act, or
mm,
just
yeah.
different things. I know, I know in Kentucky they have some laws and policies that were put in place bearing Breonna Taylor's name.
Mm,
But even those policies were not the original policies that they presented. From my understanding, um, they adapted a few things and took a few things out, made some edits. And
right.
so just thinking about, those things, I really do. I wish, and to come full circle with us, being social workers and even in the school of public health. thinking about uh, the social, social service fields, even counseling, all those fields. When you think about the fields that we are in, social work, public health, counseling, all those different fields, you would think, given the ideas and theories and thought processes at which we are taught within our educational system, that the idea of social justice would be more at the forefront of
Mm-hmm.
those fields. And so you would think that those inequities, you would have more people in those, in those, with those degree backgrounds fighting much more for the idea of social justice, or restorative justice, transformative justice,
Mm.
whichever, whatever, any and all of those things.
Right.
And so not not seeing that not seeing that realized is something else too. And so I am very intrigued to see what post COVID, because I tell people all the time, I don't think we're ever going to go back to the way things were pre-COVID. So COVID has changed the world, and so and it's going to be a continuous change. So now we got to
Mm.
realize what is going to be the new normal post COVID. So I am going to be interested to see um, what things are going to look like post COVID.
No, absolutely. And I know when they had the social worker that works for HUD at the conference, I know she had asked about
Mm-hmm.
like what things need to be changed, like how things should be like changed in terms of policy. Well, it starts at the grad school level. Like you can't like just only focus on gearing us to be clinicians and to get a private practice. And number one, you're not teaching business fundamentals to have a good private practice where there's no marketing, teach marketing skills, like you don't teach anything. Just have a private practice or gear us to take a culturally biased test, and without having with and then not having more courses about social justice, especially everything that transpired, and yeah, especially not including a twice impeached Agent Orange is doing foolishness literally every day for 5 years, because I include his year as a candidate
Mm-hmm.
and he's still acting a fool now. So all that, and like you're right, still nothing changed in terms of policy. I've ranted and complained about the NASW as the national chapter. They dropping the ball numerous times during the COVID era from 2020 to 2022. So it's like, okay, if it's not coming from NASW, it's not coming from the grad schools. They're like, all right, like like what? And the politicians are not doing anything. If anything, it's gotten worse with all these laws like going backwards, and we're losing more rights and losing all these things. Voter suppression going crazy. So it's a lot happening, and not in a good way.
Yeah, I agree. I agree, and that's what I say. It's going to be interesting to see what happens with this presidential term, because it's going to be interesting to see who runs, who wins, kind of, just how all of that is going to work itself out. Just, it's gonna be, yeah, it's going to be interesting. It's going to be interesting.
Yeah,
So
for real.
I'm mm, I don't excited is not the appropriate word. I'm intrigued. I'm intrigued to see what the future holds for us. I'm intrigued.
Yeah, it's
Yeah,
an
I'm good.
interesting time that we live in
Mm.
in America. That's for sure.
Yeah, yes, sir. Yes, sir. Yes, sir.
Where can people find you?
Oh, well, I probably should have had my card with me because you know my website is very long, but it's air AIR consulting and coaching.com. So that's the website. That's my website. Um and then it's air consulting and coaching in some form, whether it's consulting and coaching LLC or just air consulting and coaching on all platforms. But then also you have my I can give out my personal Instagram for those that would like to reach me on my personal Instagram. It's 10DAWG DJCDI. So that's my personal Instagram. I don't mind. I give out my work cell, which is 803-567-3335. Once again, that's 803-567-3335. Um, Also, my personal email, which is cding1409@gmail.com. So those are a few ways in which people can reach out to me. I would love to connect with any and everybody, even those that even oppose some of the thought processes and things that I've talked about.
Mm-hmm.
I iron sharpen iron, so I love to engage and have dialogue with everyone.
No, absolutely, and it's important that we kind of get back to it's okay to agree to disagree and just keep it pushing without the whole banter like back and forth and like the name calling and
Mm-hmm.
if you got it's okay to call out somebody. Sure, I had to call out uh uh I call him like an acquaintance now. He was a good friend of mine in undergrad, but he's definitely super
Mm-hmm.
Republican and totally against harm reduction, all the stuff in New York. And it's like
Mm-hmm.
I literally had to like the research shows harm reduction works. I work in the field,
Mm-hmm.
social work. It does work. Get some education. Get off
Mm-hmm.
get off the high horse of your badge because the police officer in New York, but they get off your high horse. And it does work. And talk to there's plenty of social workers, dope amazing social workers in New York. So
Mm-hmm.
it does
Mm-hmm.
work. So sometimes you just got to shut people down, like 'cause people just talk with outside side of their mouth without knowing stuff. So,
Mm-hmm.
but overall, it's agree to disagree and keep it pushing.
Mm-hmm. Mm-hmm. And I think that's important. I think it is good to be able to agree to disagree because I think people a lot of times when you have disagreements or when you on either side of a discussion, you need that pushback to really understand and see if what you're saying is actually factually correct. And so you do need to be able to, to defend why do you feel a certain way, or I think defend is probably the wrong word, but justify to
Mm,
provide actual factual reasons why do you have the perception or the idea, the concept of what you have. And so I think that's what's really needed because a lot of times you will run into people who, once you begin to have a discussion, even people who won't agree with you in the moment, when you leave the discussion, they'll sit back and really think, I really had no valid points for that perspective. And that's how a lot of times when you're having different conversations that you are effective because people may come to you later on and be like, well, I felt this kind of way, but you brought up some good points. I'm going to research, or I'm going to look that up, or I'm going to, and so that I think that's the point and purpose of having disagreement is for people to provide evidence as to why they feel that way. And if it's really good evidence, it can make you either change your mind or at least go and research to see if your position is really factual.
right. All right. And I'm gonna say this because we is gonna happen. Dr. Ingram.
Yes, sir. Yes, sir. I appreciate that. I appreciate that. So yeah, let's put
put
it out
that
there in the
put it in
space.
existence. Absolutely,
Yes, sir.
it's
Yes,
gonna
sir.
happen. Thank you so much for this engaging conversation. Don't be a stranger.
Yes, sir. No, thank you. I would love to come back. I honestly would love to come back. So I would greatly appreciate the opportunity to come back again.
Oh yeah, absolutely, man. Maybe down the line, season 7.
Okay, I'm looking forward to it. I'm looking forward to it.
All right, have a good
Yes,
one.
sir.